Been through a lot of disasters and hurricane. This one was very unique and different. Even with all the years, this is probably the most devastating one we ever had. On Friday before the storm, we had a meeting to address some of the concerns that would come in. Even then, we were thinking the storm was not going to be as bad as we thought. So we had a few things in place. By Saturday afternoon, I got a call from one of the supervisors, which was Miss Jennifer Altman, who let me know how things was going at that time. I live approximately 45 minutes from where I work. I got in my car right at 4 o'clock and drove from 4 to 5 o'clock to get here. It took me a little over an hour to drive. I'd come in a different route. As I came through the town, the flood had already started. To let you know how the flood was, I came through and within 20 minutes when another manager's call was trying to get in, and she asked which route did I use, and I told her, and she says, flooded, you can't get through. I got in and checked in approximately at 5 o'clock, and then we started on the road. We had, from the time I got here, it was getting to be busy. We began to get staff calling in. They can't come to work. They don't have lights. They can't see what they're doing. We had a few call-outs at that time, and everything was starting to crank up. We saw people who had masters who actually was around helping the patients, assisting the patient, helping with bathroom care, flushing commode, or whatever it came. And we worked as a team. And that was probably the biggest time we worked as a team. When I saw nurses stepping up beyond it, let me know that they are caring people. We care for our neighbors. We all really went doing the right thing. It was not about the money. It was about the heart, taking care of the patient.
Due to flooding, I had actually stayed at Southeastern Regional for 4 days and 4 nights. We were working day and night with very minimal sleep. We were very busy, and on that Wednesday I was actually charge nurse, and we started off a regular busy day in the ICU. Around 10 o'clock we lost power. We were aware of the generators being on and having some issues with those. We just had a really busy day, and so we weren't concerned with, we were just taking care of patients at that time. We did lose power, and immediately we had an influx of staff trying to help us in every way possible, seeing what we needed. We had to stabilize all the patients due to no power, and we actually called trying to get in as many patients shipped to different facilities as possible. We were very successful with that and was able to move all 19 patients out of the ICU in a short amount of time. Our critical patients, of course, went first, and other patients that were able to go to other facilities were able to move. We had an awesome staff. Everyone was willing to step in and give a helping hand, do anything possible that needed to be done. Patients and everyone was so thankful and so helpful to do anything just to be able to be a part of the need that we had at Southeastern Regional. We had physicians, we had employees, nurses from every entity in our hospital trying to help out in our ICU. It was an amazing day, but a humbling day to be able to everyone to step in and just be able to just say, here I am, let me do whatever I can for you.
It was just after 7 o'clock. We had just started change of shift, and we received a phone call stating that a patient was down in the parking lot and delivery was imminent. And we were actually in the middle of a hurricane. We had just been through Hurricane Matthew, and we were not able to take patients up on the unit right away, so we had a mobile unit set up outside to handle the services that we needed handled, including labor and delivery. So myself and one of our certified surgical techs had to run downstairs after we got that phone call because we have to keep so many registered nurses on the unit at all times. So myself and her were the only two who were able to go downstairs, so we ran through the hospital to get downstairs to the mobile unit to see just what the situation was. They didn't know if she was full term, if it was going to be preterm, if the baby was breech, or if it was going to be a normal delivery. So we ran downstairs to get to the mobile unit, and when we got there, the baby had just been delivered just like a moment or two earlier, so we had just missed it. But we were able to see the way everyone was working together to try to get this baby okay, to make sure the baby was stable, to make sure mom was stable, and it was awesome to be able to be a part of that.
In the past, we all had our own jobs that we did, and we may not have recognized the value that another job brought to the organization or what it took to do that job. But because so many people were so selfless during this time and did whatever job needed to be done, regardless of what they would normally be doing, there's a better appreciation for what each other does. There's certainly a stronger bond and camaraderie than we had before because we went through some pretty harrowing times. It was an amazing effort of a number of people who, many of them had lost everything at their homes, but came to work with a smile on their face and said, you know, there's a higher need here than my own personal need, and I'm going to put the needs of others before myself. That was just amazing to watch.